Good morning, I'm Dr. Thomas Gilbert from MVS Wound Care and Hyperbarics. I had the opportunity to be both a patient and a physician here at the Wound Care Center. May of 2018, I had fallen 15 feet from a ladder and suffered a fracture of my heel or calcaneus. It was a pretty ugly fracture in that it was comminuted, therefore it was broken in more than one piece. It was actually 3 pieces. And it required surgical intervention. I had surgery on my foot, and they put in 3 plates and 9 screws into my heel. That approximately a month later, my wounds came apart. My surgical wounds opened up, and what we refer to as dehisced. And within time, my plates and screws became exposed. Usually, under normal circumstances, we would go back in, remove the screws and plates, because now it's an opportunity for an infection to get into the bone. I suspected that I could heal the wound without going back for another surgery, as I was not interested in having another open procedure done. So I turned my wound care over to a colleague here at the Hyperbaric facility, and we began debridement of the wound and cleaning the wound up, and we began Hyperbaric Oxygen Therapy. We did use some bioengineered skin substitutes on my wound. It was a placental membrane that has amniotic and chorionic growth factors. And then we started hyperbaric oxygen therapy, and the advantage of hyperbaric oxygen therapy, it allows for the release of what we refer to as vascular endothelial growth factor, which leads to the development of angiogenesis or new blood vessels in the area of wounds that don't heal well. In addition, it causes the release of growth factors that are necessary for wound healing, causes mobilization of stem cells, and it causes decreased inflammation in the wound. In addition, it has a synergistic effect with antibiotic therapy. So if you're on antibiotics, the hyperbaric oxygen helps assist the antibiotics get across the cell wall. My dilemma was quite long and very complicated, but by December of that year, I was able to heal my wound, put on a shoe, and walk normally without any discomfort or pain. My wound healed nicely, and I've never been back to the OR since that time.